Joe Agostinelli, Social Media Manager at Greenway Health, and this is Putting Possibility into Practice, the podcast from Greenway Health. And today I am joined by Sherry Cuba. Sherry is the Chief Information and Compliance Officer for Treasure Coast Community Health. And this podcast is being recorded from the FHIMSS 2018 conference in Las Vegas, Nevada. Sherry, thank you for taking time out of your busy day to meet with us.
No problem whatsoever.
Sherry, first off, let's talk a little bit about your practice. How big is it? Where are you guys located?
Treasure Coast Community Health is located in Indian River County, which is in the southeast of Florida. We are 5 locations and a little over 200 employees at this time. We have around 19 physicians and a dozen or so dentists as well.
And how long have you been with the organization?
It's actually 9 years today that I've been with the organization, and we've grown from 45 employees when I started to how big we are now at over 200.
And that'll lead into my first question for you. How has Treasure Coast Community Health grown their presence in the community, throughout the 9 years that you have been there and in the services now that they provide?
So when we first started, have always been primary care practice. So we now offer family practice, pediatrics, gynecology, behavioral health, substance abuse, and dental. We've grown into almost all the areas of Indian River County. We see just over 19,000 unique patients last year, and they saw 87,000 visits. So we're a mid-sized organization.
Over the past 9 years, even in just the past 9 weeks, 9 months, and sometimes even maybe 9 days, healthcare changes rapidly. Over your time with Treasure Coast, how has the industry evolved into the services that you use now with Greenway Health?
So when we first started with Greenway Health, we of course were on paper. It was a big process. What do you do with the paper? We went with a partner of Greenway Health and started scanning, and then started on practice management at first. We did a year on practice management. Then we moved over to the EHR, and that was a great experience. So we had trainers come in. We took each site up, which at that time was 2 sites, and then we took the next site up. It was, we were on 7.0, I believe. We used to be on Medical Manager, which was the very first product we started with. And we had 1 server, and the backup was you put a tape in the computer, and one of the girls took it home with her. So that was our backup back in 2008, 9. Then we moved on adding practice analytics into our basket, and we use that for all our reporting. It's an awesome tool that has grown as we've grown. It's robust, gives us wonderful reports. We can make our own reports, which is always an awesome thing. There's some canned, but there's also that ability to do what you want to do. We've recently added chronic care management to our programs. We have My Health Record, which is the patient portal. We brought that on 2 years ago. Prior to that, we had the third-party vendor for our portal, which was not near as friendly now as having My Health Record. It's awesome. You can import and export. It's a wonderful tool for our patients, keeps us connected with them. And as you've changed in healthcare, like you said, now we have to do so much more in order to meet performance levels, fill those care gaps. With the system, we're able to have health reminders based on chronicity, age. It keeps us up to date with our patients. We're now going into Greenway Community, which is the population health product, and that will be going live in a week. So we're really excited about that one as well.
Great. And just talk about, as a federally qualified health center, the challenges you face as federal guidelines and mandates continue to change and evolve.
As an FQHC, it's a very unique animal, is what we always say. On top of the normal regulations for a healthcare organization, maybe as a private practice or a group practice, we come under strict guidelines with HRSA and the Department of Health and Human Services. We have what we call a Uniform Data System, which is the UDS, and it's done every year, and it changes. So it changes much like meaningful use changes with your clinical quality measures. And we're always investigating that further. The rules change just a little bit every time we do a UDS. So if you ask anybody at Greenway who works on development for UDS, you'll find that it's a big job to stay up with what the government is making mandated for us. We run into the getting funded. So this last year we experienced the cliff where we were actually unfunded for a few months, and there were so many people that contacted their congressmen, their senators to get a bill passed to give us 2 more years. So that's always something as well. We do a sliding fee scale, which helps the underserved and give them a better rate to come and see us and get their health care taken care of.
And that's great to hear. Multiple locations, and we talked about that in the beginning. You said 5 locations. How important is it to have one EHR? What was the process like in finding the right partner as you settled on Greenway Health? And then we'll further that with what advice would you give for other multiple location practices who may be looking for solutions?
So we investigated a few EHRs when we were first initiating going to electronic health records. And one of the big things we were looking for was an enterprise environment where if we were in our North County office and I needed to look at a chart and I was in the South County office, I could do that. A patient could go anywhere with an enterprise that you could be seen, and you've got all of the records there. Everything's right up to the minute. We have a lot of mid-levels, and they may call one of the physicians for a question on a patient, and that physician can be in any office and pull it up and see that. We looked at doing individual companies, and the nice thing too with Greenway is if you wanted to do that, you could do that. You could set up each of your places as a unique location, but for us that just didn't seem like the right way to go. So my advice, if you're looking, is look at everything. See what it is that your workflow is doing. Is your workflow a multi-practice that practice A wants to see what the office is doing over on the east side of the county and see those same patients, so a patient doesn't have to travel if they don't want to, and they could see you at a different location. It's important to, I guess, really make sure that you're picking the right product, because it's a big investment, it's a big time investment, and we've never felt that we made the wrong choice when we chose Greenway.
And one last question, I want to go back on something you had talked about earlier, was the patient portal. In this digital age, and you said you've been with it a couple of years now with the patient portal, how important is it to have a communications tool like a patient portal, especially when you have so many patients at so many different locations, just for communicating with patients and enhancing patient engagement with your providers?
So our patient portal, one of the exciting things that just happened recently was the ability to broadcast on your portal. So we had a hurricane in September in Florida, so we of course had to shut down. So we were able to broadcast out to our patients that had appointments that we were closing, and then again when we were opening we were able to do that. And the portal is just one of the best ways to reach out to people, send them out their appointment notices. If they happen to have questions, they can order their prescriptions right from there. We put in education for them. We also, when we get a brand new patient, we get their email and information, so we can send them directly to the portal before they even see us and fill out their paperwork, so they're not sitting in the lobby and feeling like they're waiting forever to see their doctor. So to me, it's been the best thing that we have, and almost everybody now has a smartphone. My 80-year-old mother has a smartphone, so the portal adapts to automatically to a smartphone, so it makes it very user-friendly for us.
Great, Sherry. I want to thank you not only for being a longtime customer of Greenway Health, but for taking the time here today to join us on our podcast, Putting Possibility into Practice.
Thank you, sir. I appreciate it.
That was Sherry Cuba, the Chief Information and Compliance Officer at Treasure Coast Community Health, a customer of Greenway Health, as we discussed different product solutions that they are utilizing at their multi-location practice in Southern Florida. We thank her for taking time to be with us on this episode of our podcast. For more information on the product solutions that Greenway Health offers, I invite you to visit our website at www.greenwayhealth.com. greenwayhealth.com. I'm Joe Agostinelli, Social Media Manager at Greenway Health, and this has been Putting Possibility into Practice.